Are you wondering what Alfuzosin is used for? In this comprehensive video, we will explore the primary indications, dosing details, potential side effects, and user experiences of Alfuzosin. Alfuzosin is a prescription medication commonly used to treat symptoms associated with an enlarged prostate, also known as benign prostatic hyperplasia, BPH. It belongs to a class of drugs called alpha blockers, which relax the muscles in the prostate and bladder neck to relieve urinary obstruction and improve urine flow. When it comes to dosing, Alfuzosin is typically taken orally once daily, preferably with a meal. However, it's important to note that the dosage may vary depending on the individual's medical condition, response to treatment, and other factors. Like any medication, Alfuzosin may have potential side effects. These can include dizziness, lightheadedness, nasal congestion, and headache. It's essential to discuss your medical history and any ongoing medications with your healthcare provider to minimize the risk of adverse effects. To provide you with a well-rounded understanding, we will also include user experiences and insights into the effectiveness and tolerability of Alfuzosin. Stay tuned for an informative dive into the world of Alfuzosin. Primary indications for Alfuzosin. Alfuzosin is primarily indicated for the treatment of benign prostatic hyperplasia, BPH. BPH is a common condition in which the prostate gland enlarges, causing urinary symptoms such as frequent urination, weak urine flow, difficulty starting and stopping urination, and a sense of incomplete bladder emptying. The alpha-blocking properties of Alfuzosin help relax the smooth muscles in the prostate and bladder neck, relieving the pressure on the urethra and improving urine flow. This can significantly alleviate the bothersome symptoms associated with BPH, allowing individuals to regain control over their urinary function. In addition to BPH, Alfuzosin may also be used off-label for the treatment of other conditions such as ureteral stones and chronic prostatitis. However, the efficacy and safety of Alfuzosin for these conditions have not been extensively studied, and its use should be discussed with a healthcare professional. Dosing details for Alfuzosin. The dosing of Alfuzosin can vary depending on several factors, including the individual's medical condition, response to treatment, and other medications they may be taking. However, the typical recommended dose of Alfuzosin is 10 mg once daily, taken orally with a meal. It is important to take Alfuzosin as prescribed by your healthcare provider. Do not exceed the recommended dose or alter the dosing schedule without consulting a medical professional. Alfuzosin should be swallowed whole and not crushed, chewed, or broken. This ensures that the medication is released slowly and provides a sustained effect throughout the day. Taking Alfuzosin with food can help enhance its absorption and reduce the likelihood of experiencing certain side effects. If you miss a dose of Alfuzosin, take it as soon as you remember. However, if it is close to the time for your next scheduled dose, skip the missed dose and continue with your regular dosing schedule. Do not double up on doses to make up for a missed one. Potential side effects of Alfuzosin. As with any medication, Alfuzosin may cause certain side effects. It is important to be aware of these potential side effects and discuss them with your healthcare provider. Common side effects of Alfuzosin may include dizziness, lightheadedness, nasal congestion, headache, fatigue, and stomach discomfort. These side effects are usually mild and transient, resolving on their own as your body adjusts to the medication. However, if they persist or worsen, it is important to notify your healthcare provider. Less common but more serious side effects of Alfuzosin can include a rapid or irregular heartbeat, fainting, chest pain, and severe allergic reactions. If you experience any of these symptoms, seek immediate medical attention. It is worth noting that Alfuzosin may also interact with certain medications, potentially leading to adverse effects. Inform your healthcare provider about all the medications you are taking, including over-the-counter drugs, herbal supplements, and vitamins, to ensure there are no potential drug interactions. User experiences with Alfuzosin. User experiences with Alfuzosin can vary depending on individual factors and the severity of their condition. However, many users report positive outcomes and improvement in their urinary symptoms after starting Alfuzosin. Some users have mentioned that Alfuzosin helped them regain control over their bladder function, reducing the urgency and frequency of urination. They also noticed an improvement in the strength and consistency of their urine flow, making it easier to empty their bladder completely. While some individuals may experience mild side effects such as dizziness or nasal congestion, they often find that these effects diminish over time as their body adjusts to the medication. Many users report that the benefits of Alfuzosin outweigh any temporary discomfort they may experience. It is important to note that user experiences are subjective and can vary from person to person. What works well for one individual may not have the same effect on another. It is always recommended to consult with a healthcare professional before starting any medication to determine the most appropriate treatment plan for your specific needs. Precautions and contraindications for Alfuzosin. Before starting Alfuzosin, it is important to inform your healthcare provider about any pre-existing medical conditions you may have, including liver or kidney disease, low blood pressure, or a history of heart problems. These conditions may affect the suitability and dosing of Alfuzosin for your specific case. Alfuzosin is contraindicated in individuals who have a known hypersensitivity or allergy to Alfuzosin or any of its components. If you have had an allergic reaction to Alfuzosin in the past, it is important to discuss this with your healthcare provider before considering its use again. Alfuzosin may also interact with certain medications, including other alpha blockers, antifungal drugs, antibiotics, and drugs used to treat erectile dysfunction. It is crucial to disclose all medications you are currently taking to your healthcare provider to minimize the risk of drug interactions. Alternatives to Alfuzosin. While Alfuzosin is an effective medication for managing BPH symptoms, there are alternative treatment options available. These alternatives may be considered if Alfuzosin is not suitable or well tolerated for an individual. Other alpha blockers, such as tamsulosin and doxazosin, are commonly prescribed for BPH and may provide similar benefits to Alfuzosin. These medications work in a similar manner by relaxing the muscles in the prostate and bladder neck. In some cases, healthcare providers may recommend combination therapy, which involves using a medication from a different class alongside an alpha blocker. For example, combining an alpha blocker with a 5-alpha reductase inhibitor, such as finasteride, may provide more comprehensive relief of BPH symptoms. Ultimately, the choice of treatment will depend on individual factors such as the severity of symptoms, medical history, and personal preferences. It is important to discuss these options with a healthcare professional to determine the most suitable approach for managing BPH. Alfuzosin versus other alpha blockers. Alfuzosin, tamsulosin, and doxazosin are all alpha blockers commonly used for the treatment of BPH. While they belong to the same class of medications, there are some differences worth considering. One key difference is the dosing schedule. Alfuzosin is typically taken once daily, while tamsulosin and doxazosin may require multiple daily doses. The dosing frequency can influence convenience and compliance with the medication regimen. Another difference lies in the selectivity of action. Tamsulosin and Alfuzosin are more selective for the alpha-1A receptor subtype found in the prostate, while doxazosin acts on multiple alpha-1 receptor subtypes found in various tissues. This selectivity may contribute to differences in efficacy and side effect profiles. Side effects can also vary between these medications. While they all share common side effects such as dizziness and nasal congestion, the frequency and severity may differ. Some individuals may find one medication more tolerable than another based on their personal experience. Ultimately, the choice between these medications will depend on individual factors and the recommendations of a healthcare professional. They will consider the specific needs and characteristics of each patient to determine the most appropriate treatment option. Consultation with a healthcare professional before taking Alfuzosin. Before starting Alfuzosin or any other medication, it is essential to consult with a healthcare professional. They will evaluate your medical history, perform a physical examination, and consider any potential drug interactions or contraindications. During the consultation, it is important to provide accurate information about your symptoms, medical conditions, and any medications you are currently taking. This will help the healthcare provider make an informed decision about the most suitable treatment option for your individual needs. Additionally, they may discuss potential lifestyle modifications that can complement the medication's effects. These may include dietary changes, increasing physical activity, and managing fluid intake to optimize bladder function. Regular follow-up appointments will allow the healthcare provider to monitor your progress, assess the effectiveness of the medication, and make any necessary adjustments to the treatment plan. Conclusion and final thoughts on Alfuzosin. Alfuzosin is a commonly prescribed medication for the treatment of benign prostatic hyperplasia, BPH. It works by relaxing the muscles in the prostate and bladder neck, relieving urinary symptoms and improving urine flow. When taking Alfuzosin, it is important to adhere to the prescribed dosing schedule and discuss any potential side effects or interactions with your healthcare provider. User experiences with Alfuzosin can vary, but many individuals report positive outcomes and improved quality of life after starting the medication. If Alfuzosin is not suitable or well tolerated, There are alternative treatment options available, such as other alpha blockers or combination therapy. The choice of treatment will depend on individual factors and should be discussed with a healthcare professional. Remember, before starting any medication, including Alfuzosin, always consult with a healthcare professional who can assess your specific needs, provide personalized advice, and monitor your progress. With the right treatment approach, you can effectively manage BPH symptoms and enjoy a better quality of life.